Dr. Randeep Guleria is the director of Delhi's All India Institute of Medical Sciences, and he's also a well-known pulmonologist. Dr. Guleria, thank you for your time.
Thank you.
We are in fact connecting essentially on a day when Delhi's AQI, also the AQI of other cities surrounding Delhi and many other parts of the country, is in fact at the hazardous level. Do talk to us about the long-term effects of pollution, what we see today, what we are facing today, and the kind of impact it's going to have on our health in days and weeks to come.
So I think this is a cause of concern, and this is something we have been seeing for the last many years, that during the winter months, and especially around Diwali, the AQI in the Indo-Gangetic belt goes into the hazardous or the severe range, which has a huge effect as far as the population living in this area is concerned. The effects can be both short-term and long-term. Short-term effects are seen mainly in those who have underlying respiratory or cardiac problems, that there's worsening of the respiratory problems, emergency visits increase, and they need more and more medication, and some of people land up also in the ICU. There's a long-term effect also, which is also there in children, because children are regularly now spending years growing up in these cities and inhaling such high levels of pollutant air that it starts affecting the growth of their lungs, and lung growth actually tends to suffer. There's also data which suggests that exposure to long-term air pollution can lead to bronchitis in the long run. It can lead to other diseases, and some data which suggest that there may be a link between cancers also developing in later life to prolonged exposure to indoor and outdoor air pollution.
Yes. You importantly mentioned indoor pollution. Do you think that indoor pollution essentially in our country is underestimated? The sense is that if you're inside your house or in your office, then you're not exposed to pollution. I think that is completely incorrect, isn't it?
That's true. So when we look at indoor pollution, we must understand that sometimes, especially if you're looking at areas like Delhi, the pollution inside is as bad as it is outside, because the air tends to move in from outside inside homes into your house. But even in rural India, the situation gets compounded because of the fact that a lot of houses in rural India also use biomass as a source of cooking and for heating in winter months. So they have fires which are using cow dung or wood, and that causes also indoor air pollution. So combination of outdoor air pollution coming inside and indoor air pollution being generated because of biomass use actually leads to a very high levels of indoor air pollution, which affects not only young children but older people also who are living there and even sleeping in rooms which have got high levels of pollution.
You know, there are some who seem to be suggesting that pollutions in Delhi were on the higher side in the severe category even before Diwali, and that the Diwali crackers have got little contribution when it comes to, adding to the woes of Delhiites vis-a-vis pollution. Is that a correct assessment at all?
So pollution levels have been high during the winter months, and as we know, this is multifactorial. Some of it is related to pollution production. We know this could be related to crop burning, which happens in the northern part of India. Cracker burning, not only in Delhi, but surrounding area also contributes to this. And then, of course, there is the issue of use of fuel in terms of cars and traffic, which goes up because of people now traveling a lot during the festive season, and that also contributes to air pollution. Along with that, the weather also has a contributing factor, because when you have cold air, when the temperature starts dipping, the pollutants tend to stay at ground level. In hot air, the pollutants rise up and they actually move out. That really helps in clearing up pollutions at ground level. But during the winter months, the pollutants, because of the cold inversion effect, stay at ground level. And secondly, in the winter months, our wind velocity in the Indo-Gangetic plain becomes very less. So there's hardly any wind, and therefore the pollutants actually just stay there without moving away. And this causes a huge effect to people living in this area, which is landlocked.
You know, Dr. Guleria, in the longer run, it is estimated by various studies who seem to be suggesting that the longevity of an average Delhiite's life is also reduced up to even 9 to 10 years because of constantly living in a polluted environment. Is that correct?
So there is data which is looked at, modeling data, which suggests that there's a reduction in one's lifespan if one is living in polluted areas. And that can be debated as to how much is the effect, but it is significant. There is also data which has come out both from studies which have been published in 2017 and in 2019. The Health Effect Institute has also come out in 2020 as far as the global air pollution is concerned. All of this suggests that pollution levels are increasing and causing significant long-term health effect, which have affect both lifespan and morbidity. As a matter of fact, there is now data from India which suggests that exposure to pollution in this part is actually causing more harm than the use of tobacco or the use of smoking. So we talk a lot of banning some cigarette smoke in various places. I think it's more important than to look at how do we ban and bring down the levels of air pollution. Many diseases now are getting aggravated by pollution more than they are getting aggravated by exposure to tobacco or to cigarette smoke.
You know, in AIIMS and other hospitals also, what's the kind of increase that you're seeing in terms of the people coming to you with these common complaints of breathlessness and chest congestion because of pollution?
So there is always a significant increase of almost 20 to 30% whenever you have high levels of pollution. About 2 years ago, we did a study which was sponsored by ICMR, where for 2 years we followed up our patients, our admissions in children and adults in the emergency throughout the year, and looked at the number of people coming with chest problem and the levels of air pollution. And we clearly showed that whenever pollution levels goes up, in the subsequent 5 to 6 days, the number of people reporting to the emergency, both children and adults with respiratory congestion and respiratory failure, goes up significantly. So there is data which is convincing from our hospital also, which suggests that exposure to high levels of air pollution leads to worsening of respiratory problems, whether you have asthma, whether you have bronchitis, and leads to increased emergency visits, which can also lead to increased ICU admissions.
You know, you did mention that COVID-19 also, the cases increase due to pollution, and not just that, the severity increases because of pollution. Do explain to us the direct link between pollution and this infection and the pandemic.
So there has been now data. There was one paper which came out during the SARS outbreak 2003-2004 from China, which showed that in the provinces where pollution levels were high, they had higher death rates as far as SARS was concerned. Then we had a paper last year which came out from Italy, northern part of Italy, and this paper clearly showed that as your PM 2.5 levels increased, there were excessive death in certain areas in Italy because of COVID-19. Now there is a paper from the United States which has looked at all areas in the US and looked at mortality because of COVID-19 and air pollution in those areas, and again shown that if you have high levels of air pollution, then the chances of having more severe COVID and dying because of COVID goes up. And this makes some scientific sense also, because pollution also attacks the lungs. It causes inflammation in the lungs. It causes weakening of the lung responses. And then when you have COVID on top of that, the COVID also attacks the lungs and causes inflammation. So it causes a double effect, and therefore it leads to more severe effect on the lung, which leads to fall in your saturation and has more severe effects leading to hospital admissions. There's also some data which suggests that when you have high levels of pollution, the virus may stay in the air for a longer period because it attaches to the pollutants and then stays in the air for a longer period. That data is not needs to be validated further, but that is also there. So the virus can be more infectious in that form. But what is more concerning is that if you have pollution and COVID, you can get more severe COVID.